Hi, Ari. I'm excited to have this conversation with you today. Would you like to introduce yourself before we get started?
Yes, so my name is Ari. I'm a psychologist, have been for about 8 years or something like that. I have different experiences in different areas of psychology, forensic psychology, clinical, counseling, etc. But I specialize now in inner child therapy, specifically with childhood trauma, and I work via the subconscious and the body to release repressed negative energy. Yeah.
Great. And I think what we're going to start with is just a basic question that might actually get deeper, but what is trauma?
Yes, so I would say trauma is basically an unresolved emotional response that's stuck in the body. The body itself is the subconscious mind. And as we go through different experiences in our developing years, some experiences can be very difficult to process, mainly because the emotions behind them are very, very powerful that the child can't exactly process and comprehend. And so they get repressed into the subconscious and they get stored there in the body. So a trauma is sort of like an emotional injury or emotional bruise, such as shame, guilt, fear, even anger, grief, are different emotional responses that can be stuck in the subconscious mind that would secretly control a person throughout their adult years without the person realizing it.
And would you say that all people and I guess all adults when they grow up have some trauma in some kind of way?
No, not exactly. I would say that if a person is well balanced, has a healthy sense of self-esteem, um, can function normally in relationships, and has good social skills, generally speaking, just a normal, adequate human being, then I would say that's not indicative of trauma. So not all the people have trauma, I would say. The only way to know if a person has trauma is if they have an inflated emotional response to something that's not exactly calibrated to the situation at hand.
And I think this connects to the next question of how will somebody know if trauma is causing the issues that they're facing versus a different issue?
Yeah, that's a good point. Um, if a person, for example, is feeling a lot of symptoms of depression, anxiety, let's say, most of the time, those symptoms has its root back to some sort of trauma that's unresolved in the person. So it could be some form of rejection, some form of abandonment, some form of blame that the person has internalized from one of their caregivers or a romantic partner, and it's completely unprocessed, sitting in the subconscious mind and controls them. So if a person, for example, is experiencing constant feelings of inadequacy, guilt, fear of people, fear of rejection, or they're constantly people pleasing all the time, or they can't be assertive, or they're in a constant state of withdrawn or avoidance, I would say that the person is harboring some sort of trauma from the past. Um, so when you say that sort of what mental health issues can be exacerbated by trauma, it's the other way around. Most mental health issues are a symptom of some sort of trauma
Of the
in the back.
trauma.
Yeah. So the most of the time that I see where people come to me and they say, listen, I've got issues of sadness, I've got issues of constant feelings of guilt, depression, I'm unmotivated, I'm scared of people, etc. What that's indicative of is some sort of trauma that they might not even realize that is unresolved there. And what that trauma is actually an energy that's sitting in the body. It's a feeling. So a lot of people go see a psychologist and they'll go undergo sort of talk therapy, so cognitive behavioral therapy, ACT, etc., etc. Um, Talk therapy is great and beneficial to intellectually understand where the person is stuck at, but it doesn't release the trauma itself, because the trauma is in the body. It's a deep-seated feeling. It's an energy. It's a sensation that's actually you can feel. And it's stuck in various energy centers of the body. So to release trauma, you have to work via the subconscious. You have to work via the body.
So would you say that clients that come to you don't necessarily know that they have trauma, so they'll come to you with other symptoms, and then it will be sort of like indicating that that is the issue?
Exactly. Yeah. So most people would say, "Oh, I'm experiencing workplace bullying. People don't like me at work. I can never fit in at work." I go, "Well, how long have you had these sort of depressive symptoms for?" "Oh, for the last year, 2 years." And then I'll get them to sort of characterize the depression. Usually it's mainly based on shame. So I'm feeling inadequate. I don't like myself. I'm not enough. And then usually that shame is something not new, and it's actually can be traced back in their timeline to some sort of original root. So then I'll ask them sort of like a domino style thing. "Well, when did you first experience shame?" And they'll be like, "Oh, I've had it for ages." "What do you mean ages? When did you first experience it?" "8." "Okay, you've been living with shame your whole life?" He goes, "Yeah, that's me." I go, That's actually not you. That's an energy you've been carrying around with you that you've actually identified with, and you think it's you, but in fact it's really not you at all. It's an attachment. It's basically a form of rejection that the inner child has internalized from one of their caregivers. And so most of 90, I don't know what the stats are, but maybe 80, 90% of people I see have some sort of root trauma in their subconscious relating back to the inner child without them even realizing it. And what happens is that the themes keep outplaying itself throughout their adult years. So they constantly feel rejected, they constantly feel abandoned, not good enough, constantly approval seeking, people pleasing, and that just keeps regurgitating itself in their adult years, and they think that that's who they are. They've identified with the trauma, not realizing that wasn't them at all, and has its root back to some sort of emotional injury in the past.
And I'm sure once they have that sort of realization, or the guidance to sort of realize that it's something bigger than that, that like starts that whole journey for them. And
Yes.
I know you do short-term therapy, so the question is, how is short-term therapy effective for trauma, and what advice would you give, I guess, for someone who is dealing with unresolved trauma?
Yeah. So short-term therapy, because what I'm doing is I'm working with the subconscious, which is inherently short-term because we're getting straight back to the roots. I'm not concentrating on their adult years. I'm concentrating on their developing years, let's say 0 to 10. And once you get to the root of everything, then the whole ego collapses, and you don't have to. The long-term route is talk therapy, which is sort of very, it doesn't get to the root, it doesn't get to the core of the problem, and it takes a long, long time to get to the root via talk therapy, because what you want to do is get to the energy itself, the feeling, the sensation, and be able to release it and surrender it from the body, bypassing the resistance from the ego that wants to keep the person safe and in control, and bypassing these sort of primitive resistances that kept them safe as a child, and then surrendering the energy, forgiving their loved ones, forgiving themselves most importantly, and releasing that energy from the body.
Yeah. And then would you find that people from, let's say, after 5 or 6 sessions, they already feel that sort of process has happened?
Yes. So a lot of people are amazed at how quick the results are. And I usually, 5 to 8 sessions, sometimes less, sometimes it can be 5. It depends on how ready a person is willing to face the truth of how they felt as a child and be loving, forgiving towards that inner child, and sort of reverse the justifications and positions that the inner child bought into that justifies keeping the pain, which is resistance from the ego once again, that is keeping them safe. For example, I can't let go of this fear because people might hurt me again, or I might be vulnerable, or I won't have any control or safety. These are like the primitive security systems and mechanisms that the ego has to keep the person in check. when in reality, it's based on a no longer needed security system.
And
That served them when they were a child, but no longer serves them in their adult years.
can hinder them, I guess, in the adult
Yes, yeah,
years
and
to
blocks
progress.
them, and they feel stuck and blocked, and they can't progress forward. They can't create intimacy with anyone else. They feel the constant need to be better. So a lot of them are workaholics, and they sort of never get that satisfying feeling of feeling whole inside, because what they're really chasing after is an illusion, and the issue is internal. So when people are holding on to shame, they're constantly trying to reach this external validation, but never really get it, because it's an infinite field, and it's run by a program in the subconscious that's secretly controlling them.
So for anybody who's watching this, what advice would you give if they're dealing with unresolved trauma, or if they're watching this and they didn't know that it might have been a trauma issue for them, but things are resonating with them now? What advice would you give?
I would say acknowledge, start taking responsibility for these feelings inside. The ego within us will want to project those emotions onto someone else, blame someone else, or victimize yourself, indulge in self-pity, minimize or deny your emotional experiences, which again keeps a person safe, but keeps them also stuck. And so they can sort of never get out of this matrix that they're in. So first of all is acknowledge the feelings, listen to the feelings, understand where they're coming from, try to draw conclusions, and always go back to the root of where they originate from, which is usually the inner child. And first of all, find someone who can guide you to releasing them. Understand more about one's ego and the resistances, and how they kept you safe as a child, but how they're no longer needed to serve you. So I do a lot of letting go, a lot of surrender, and it can be confronting because we're surrendering the known for the unknown, and we don't know what it looks like on the other side without our trauma to keep us safe, because it ends up becoming a security blanket. So it sometimes feels risky, and that's the whole adventure of it all. Which is it can be like a journey. But mind you, a lot of people say, oh, my healing journey and et cetera, et cetera. It doesn't exactly have to be a journey. Healing can be rather quick. It all depends on how ready you are to surrender, to let go of your emotional pain, to accept how you felt as a child and not condemning it, not judging it, not resisting it, and accepting the energy exactly as it is. And when you accept the energy exactly as it is and not modify it in any way, be it shame, guilt, grief, fear, abandonness, loneliness, anger, that energy actually comes up, it climaxes, and it evaporates from the body itself. And a lot of people experience this very light-hearted shift. So once a person releases their trauma, they experience what we call a shift. And a shift is a raise in consciousness, where they were existing on a very low vibration of shame and guilt and fear, etc., and grief. And once those energies are surrendered, a person experiences this elated, euphoric sense of connection with their higher self, and they feel a lot more free, and they're no longer in self-sabotaging, etc., and they feel more connected to who they are, and that comes up with a lot of, goes hand in hand with a lot of confidence and self-love. Another thing I really want to point out is that everyone that comes in, who a person really is in essence, is self-love and a high vibration. So when a person is programmed with all sorts of trauma growing up through their childhood years, they start identifying with that shame and guilt and fear, etc., thinking it's them. But really, it's like they're left behind who they really are, which is this higher vibration of self-love. So a lot of people say to me, you know, if I let go of the shame and actually forgive myself, what's going to be on the other side? How do I know that that my ego is telling me this is really me? It's actually not you. It's an illusion. Who you really are is a very high vibration of self-love and self-acceptance, compassion, love, peace, and joy, which is very high vibrations. That's what a person is at default. That's their birthright, except they don't realize it when they're holding on to the trauma, because it blocks their perception of it. So all the person has to do is not get that self-love outside of them, is just surrender the blocks, and then that self-love reveals itself internally.
Well, thank you. That was really informative. And I hope that people who are seeing this find that, you know, it resonates with them and that they can reach out for help if they need. And thank you so much for your time today.
No problem. Thank you.